Hello and welcome to the Brain Discovery series. I'm your host, Ellie Menashe, and this is Dr. Nedd, an amazing neurologist who specializes in brain injury. So in this series, we are going to be discussing how the brain is injured, how the brain recovers, and how this impacts people's lives. So, Dr. Nedd, if you could please tell us a little bit about yourself, how you became a neurologist, and why you decided to specialize in brain injury.
Well, thank you, Ellie. As far back as I could remember, I've been fascinated with the brain. The brain is the most complex processor known to humans.
Yeah.
Very complex. This level of sophistication, could you imagine it been destroyed in an instant from ordinary forces that are present all around us?
Like what?
Like someone falling, hitting their head against the ground, and causing a disruption of the organization of the brain. When these forces are applied to the brain, it can destroy or damage the brain to the point that it affects our ability to function in society. It affects just about who we are, what others perceive us to be. And just to think that as important a system as the brain is, so little attention is being paid to this disorder. Currently, about 1 in every 4 persons that you meet would have suffered a concussion or traumatic brain injury.
Wow. 1 in 4?
1 in 4.
Wow.
So this condition affects our social order. It affects our understanding of the world around us.
Right.
Through my years of education, I've been, over the past 32 years, involved in this field. I have developed a knowledge base that has allowed me, in some way, to impact on the field of brain injury. And that's the reason why I got involved in this field.
Right. So, what kind of training and education does one actually have to go through to get to the level where you can make such an impact that you can make?
Well, just to start from where I am today and what I'm doing, I'm involved in a comprehensive brain injury program in Miami, Florida, called the Design Neuroscience Center. And it's a comprehensive center with utilizing what we call an interdisciplinary approach to treating and evaluating persons with this condition. To get there, I enrolled after medical school at the University of Miami Jackson Memorial Health Systems in their neurology training program.
Okay.
After completing that training, I actually went on to do additional training in the field of neurological rehabilitation and neurological trauma.
Okay, you've been busy.
Been busy. So this training allowed me to take on a major responsibility at that institution, where I became the medical director for the neurological rehabilitation program and the neurotrauma program.
Wow.
And following this, I had the opportunity, or during this process, I had the opportunity to see and experience a lot of what goes on in the field, both from an administrative and policy standpoint to a clinical education standpoint.
Okay.
Having treated a large number of patients, I've been able to understand the complex nature of brain injury and how it affects our world. And what I've learned from this is that today there remains a degree of chaos in the field.
Like what?
Well, that chaos comes out as a result of a misunderstanding of what a brain injury is. Over the years, we've provided unsound and unclear definitions of brain injury, when it occurs and when someone recovers from it, and of course the impact that the injury has on our world. So here we are.
So Speaking of being busy, I heard you just wrote a book titled Concussion, Traumatic Brain Injury from Head to Tail. Congrats on that.
Thank you.
In it, I'm assuming you discuss some of these things that have caused chaos, right? So the unsound definitions and the ways of treatment.
Absolutely.
Yeah.
So I've discussed those issues and more.
Okay.
In the book, I tried to utilize the experience I've had with treating patients. I've taken the stories of my patient and used those stories to illustrate some of the important evaluation and treatment principles that are often not addressed in the field. This is a very important condition that needs further attention. By not addressing these issues in brain injury, we fail generations of people from times past and currently to the future. Just to think, military conflicts, people returning from military conflicts who suffered brain injury occurring in sports with our kids. And when you look at interpersonal violence and the state of affairs in our justice system, all of these issues have now become critically important. And it's about time that we do something about it.
Yeah, for sure. So, Dr. Nedd, we now know about your background and your clear motivation for being involved in the brain injury field. We look forward to hearing more from you in the Brain Discovery series, so stay tuned, everybody.